Hello friends, I am Dr. Rohini Ruhil. Today we'll discuss about social determinants of health. What comes to your mind when you hear this phrase, social determinants of health? Let us start with a picture. What can you infer from this picture? Here, two girls are sweeping the floor. So, these girls are fully concentrated on sweeping the floor while at their back the water is running from the tap. The tap is open. So girls are not looking at a bigger picture that they should turn off the tap and then sweep the floor. Our position in public health globally nowadays is just like that. Like we are largely focusing on proximal level determinants of morbidity and mortality. Like we are treating patients with antibiotics and painkillers, and while we are overlooking the structural level determinants of health, we are giving them medicines, treating their illness, and then sending them back. And we are not focusing on the social determinants, the structural level determinants, which are responsible for the morbidity and mortality. Now, let's look at this next picture. So, as a food for thought, what good does it do to treat people's illnesses, then send them back to conditions that made them sick? So, after treating them, we are again sending the people back to the conditions which made them sick. Like people are living in filthy conditions, the poor living conditions, overcrowding, unsafe drinking water, no sanitation facilities. Then what good does it do to treat people's illness if they live in such a condition? As a conceptual framework on social determinants of health, Solar and Irwin in 2007 gave this conceptual framework where they looked at various intermediary determinants and structural determinants that are responsible for or that are having an impact on the equity in health and well-being. So various intermediary determinants like the living and working conditions of people, food availability, the behavioral factors, biological factors, psychosocial factors, these intermediary determinants that have impact on health and well-being. And most importantly, health system, the availability of the health system, access to health system strengthening, that has an impact on equity in health and well-being. Now, these intermediary determinants are influenced by the structural determinants. The various structural determinants like socioeconomic position, social class, gender, ethnicity, education, educational level of populations, their occupation, their income. These structural determinants that influence their behavioral factors, biological factors that further have an impact on health and well-being. Now, at the topmost level, we have socioeconomic and political context, like governance, macroeconomic policies of a country, social policies related to labor market, housing, land, the public policies related to education, health, social protection, cultural and societal values of a society. So, these structural determinants have an impact on intermediary determinants which further have an impact on equity in health and well-being. So this was the conceptual framework that was given by Solar and Irwin, and this is regarding the social determinants of health discussions. Now, WHO established a commission on social determinants of health in March 2005. This was to support countries and global health partners in addressing the social factors that lead to ill health and health inequities. This commission was chaired by Professor Michael Marmot, and the commission gave its report in 2008. Now let us discuss this report in detail. The definition of social determinants of health as given by this commission. So this commission told that social determinants of health are the conditions in which people are born, grow, work, live, age, and the wider set of forces that shape these conditions. And these are the non-medical factors. Now, this commission realized that there is a wide extent of global health inequity. And in its report, the commission discussed various examples, various case studies that depict the extent of global health inequity. And what is this global health inequity? This is in three ways. First, that there is variability in life expectancy and health outcomes. That is, if a person is born in a developed country, he will have high life expectancy, whereas if a person is born in underdeveloped country, he will have low life expectancy. And this has been proven by data, by analysis of the data from various countries. And the report underscored vast differences in life expectancy and health outcomes between the countries, also within the countries. And this is correlated with socioeconomic factors. Now, second important point regarding the global health inequity is the impact of poverty. The poverty and social inequality were identified as key drivers of health disparities that influence healthcare, living conditions, and lifestyle-related risks. Third important parameter is inequities beyond income. That is, there are factors beyond income also. It is not just about economic disparity. And what are those factors? Like gender inequality, the discrimination related to ethnicity, the geographical location of populations. As a case study example, let us discuss relative reduction in the prevalence of smokeless tobacco use from GATS-1 survey to GATS-2 survey. This graph depicts the comparison of two surveys. First, Global Adult Tobacco Survey India was conducted in 2009-10. The second was conducted after 8 years in 2016-17. And these two rounds of the survey, they showed that there was a reduction in tobacco use. There was a reduction in smoking as well as a reduction in smokeless tobacco use. But if we see this reduction across various levels of material deprivation, we'll see that this reduction is iniquitous. Level 1 is the least deprived populations, and level 6 is the highest level of material deprivation. So here you can see that the relative reduction in the prevalence of smokeless tobacco use, this reduction is high for the least deprived people. Whereas if you see the level 6, the highly deprived populations, the relative reduction is actually negative. It means actually there is an increase in the smokeless tobacco use prevalence for the most deprived populations. So this is one such example. The report showed several other examples regarding morbidity, mortality, life expectancy, where the report compared several countries, the developed countries and the developing countries. Now, we have seen that there is a gap. There are health inequities. Now, how can we close this gap? How can we close this gap in a generation? The answer is by acting on social determinants of health. The commission said that we can close this gap by acting on social determinants of health. The commission gave three major recommendations. First is improving daily living conditions. Second is tackling the inequitable distribution of power, money and resources. And the third is measuring and understanding the problem and assessing the impact of action. Now let us discuss these recommendations in detail. First is improving daily living conditions. So how can we improve daily living conditions? What are the various areas of actions? First is improving the physical environment, particularly the urban living environment, providing them with clean water, clean air, adequate housing. Second important point is focusing on the early childhood development. Early childhood development because every child needs a best start in life because there is a life course approach to health. We need to provide them with good nutrition, good education, and access to health care. Now, third important point is strengthening health systems. Our health systems should be strengthened. We should be able to provide equitable and responsive healthcare, accessible healthcare to all the populations, the affordable healthcare. Now, fourth important point is gender equity. We need to empower women because gender is a critical determinant of social and health outcomes. Now, next important point is creating good working conditions. Secure income, fair income, employment opportunities for the populations. Because this is again an important social determinant of health. So these are the ways by which we can improve the daily living conditions of populations. Now next recommendation was to tackle the inequitable distribution of power, money and resources. Now how can we tackle the inequitable distribution of resources? We have studied previously and various scholars have discussed the impact of globalization, the neoliberalization, the debts, the trade imbalance, privatization, globalization, liberalization. So we need to ensure fair trade. We need to address the negative impact of globalization. Second important point is that markets should be responsible. The private sector needs to be regulated and it should be responsible and cater to public health needs. Third important point is regarding our public policies. There should be health in all policies approach. That is, all our policies of any sector, they should consider health and equity implications. Next important point is that we need to encourage community empowerment. There should be representation of weaker sections of society, tribal populations, backward populations. So all the sections of the society should be represented well in political and decision-making processes. Now, last important point in this regard is the need to implement social protection policies to mitigate the impact of economic and social distress. Third major recommendation was to measure and understand the problem and assess the impact of action. What gets measured gets solved. Here comes the importance of data. We need to improve the collection and use of data to better understand the health inequities as well as to better understand the effectiveness of our interventions. There is also a need to promote research on social determinants of health. And most importantly, there is need to establish systems for health equity and to monitor those systems. And lastly, it is important to disseminate knowledge and successful practices that have addressed social determinants of health. So these were the three major recommendations of Commission on Social Determinants of Health. To come to an end, I would like to ask a question. Is closing the health gap in a generation feasible? This question was asked by Commission on Social Determinants of Health. So the answer is yes. The closing the health gap in a generation is feasible by embracing a multi-sectoral approach. There is a necessity of partnership across different sectors such as healthcare, education, housing, employment, and finance to address the social determinants of health. And there is a need of partnership between various agencies, the public sector, private sector, international organization, intergovernmental organizations. So with this, I would like to end my presentation. Thanks for listening. Bye-bye.